I'm Ethan. I'm going to give him an intramuscular shot, and by doing that, I will show my general principles and safety practices. So first thing you want to do is gather your supplies. You would then be performing your 11 rights and 3 checks. Okay, by doing that, you would want to come in, you would introduce yourself, explain I'm going to be giving an intramuscular shot. You would then perform hand hygiene, assess for allergies, and then once you do all that, and you get consent to touch them, and 2 patient identifiers, so name, date of birth, wristband, social security, all that. You would then assess the skin. The skin looks good, no breakdown, nothing red, everything looks fine. Okay, so now I'm going to be putting on my gloves. And the sites you would use for intramuscular would be your deltoid, and to find your deltoid you would find the acromion process. Once you find that, you would do 3 fingers, draw a triangle, and right in the center of the triangle, right there, and you have your vastus lateralis, which is you divide the leg.
Everything else you did.
And then so it'd be right here. And then you have your ventral gluteal, and to find your ventral gluteal, you would place your palm on the greater trochanter, placing your middle finger on the anterior superior iliac spine dorsally, and then place your index finger palpate the iliac crest, and you put it right in the center of those 2 fingers. Okay.
I mean, I know you can.
So that's how you find those. Okay, so to give the injection, you would first uncap the vial. Once you uncap the vial, you would take off an alcohol pad. Wipe from inner to outer. Once you've wiped from inner to outer, dispose of the alcohol pad. You would then take your needle, hold it into the dominant hand, uncap with the other hand. You would want to first draw in some air. Say about, I don't know, half a mil here. Want some air. You would then want to place the needle directly in the center of the vial, not the outer edges. That you want to pull up. Make sure you stabilize the needle without touching the plunger. You don't want to touch the plunger. Draw in. So this would be, say, a flu shot. So you're going to give a flu shot intramuscularly. And then once you draw that in to an angle, you want to take out the needle. Once you've taken out the needle, you'll use the scooping method to the needle. Okay. Once you've got your medication drawn, you're then going to take another alcohol pad, wiping. You're going to find your skin. You are going to then wipe in a circular motion. You don't want to blow on it or to fan it by any means. Discard the other alcohol pad. You would then take your needle. Now with the intramuscular needle, you are going to inject at a 90-degree angle. Once again, hold with dominant hand, pull with that hand. Once I go in at a 90-degree angle, you are then going to push the medication in slowly. Okay, and then pull out quickly at the same angle that you went in from. You are then going to hit the safety part on the needle, capping it and putting it in the sharps container. Once you have done that, you would want to apply gauze. You would then assess the skin, assess the patient, make sure the patient's okay. Once you do all of that, you would then doff the gloves, perform hand hygiene, report and report.